Bone grafting immediately following the removal of teeth helps to preserve the socket and ensures that the implants are placed in adequate bone. Grossly decayed teeth are extracted. Allograft material is placed in the tooth sockets following the extraction of the teeth. The grafted area is then covered with a specialized protective membrane to ensure proper tissue growth. At this time, gum tissue is sutured over the graft. Then, the site is prepared for implant placement. The implants that have been placed are then covered with healing screws that are called healing abutments. Following a healing period of 4 to 6 months, the implants are again exposed, and titanium posts called abutments, which secure the crowns, are screwed in. And then the permanent crowns are cemented in place.